set an example in the community that we can encourage others to follow. As a result, we have reduced the county's in-person services, including several that had been added back after the initial stay-at-home order expired last spring. Among the changes that are listed on our website, mecnc.gov, all indoor services are temporarily suspended at park and recreation facilities. They are not accepting reservations for indoor or outdoor facilities for the next 3 weeks and closing all recreation, senior, nature centers, the aquatic center, and the skate park at Naomi Drennan Center. Those that had reservations to use these facilities over the next 3 weeks will be contacted by Park and Rec staff to either reschedule or get a refund. And this includes all organized sports. All parks, greenways, nature preserves will remain open until dusk, and people can still enjoy outdoor amenities, including tennis, golf, and pickleball. The changes do not affect mandated and essential services that have continued during the pandemic. And although some health clinics and services may change, our COVID-19 vaccination clinics will continue operating 6 days a week. So for the most part, the county is operating in a similar fashion to the initial stay-at-home order that was issued in March. In terms of our MEC pre-K program, we are letting each of our providers determine whether or not they want to provide virtual programming. MEC pre-K operates in community-based childcare centers. Childcare is an essential service and has been operating consistently throughout the pandemic. And with that, I will turn it over to Gibby.
Thank you. Good afternoon. As you know, our numbers continue to remain at very high levels here in Mecklenburg County. We will release an additional data report tomorrow morning. I've been receiving emails from the community throughout the pandemic, many people providing input, sharing thoughts and concerns with me. This week has been no different. And as you expect, there are opinions on both sides of every issue. I want to thank everyone who takes the time to share their thoughts with me. Those perspectives are important to me, and although I'm not able to respond to all due to the volume, please know that I do read them and take into account your thoughts. I want to provide some continued clarification of the directive that was issued on Tuesday. The Health Director's directive is intended to alert and advise our community of actions needed across all sectors to reduce the current level of COVID-19 community transmission. While it does not carry the weight of law, an executive order, or an emergency order, this directive is a strong recommendation to our community members to help us all in our ongoing efforts to control the spread of the virus and to prevent further spread, severe illness, death, and overwhelming our public health and healthcare systems. There have been a lot of concerns voiced about schools and about sports, about outdoor venues, as well as our businesses in our community. Schools are not required to shift to virtual learning, though it is advised. And as you know, our school board decided today to stay in remote learning for another month. Current evidence suggests that schools are not predominant sources of transmission, and we support prioritizing in-person learning in our community. We know it's important to our students, to their families, to the teachers that provide that service. However, the current levels of community transmission significantly increase the likelihood that many more students and teachers will come to school while infectious. So I applaud the school system for the decision that they made earlier today. Also, non-essential businesses are not required to close in-person services, though it is advised, particularly for indoor settings like restaurants and other entertainment venues where individuals remove their masks to consume food and beverage. Delivery services and alternative pickup methods for food and retail is encouraged. In this directive, no entity or activity is targeted. Everyone needs to limit their exposure to others for the next 3 weeks if we're to be successful in getting this pandemic under control. Lastly, I want to thank those who have taken our situation in Mecklenburg County seriously and are doing their best to comply with the directive. I am pleased to work for a community where the county manager, the county organization supports the work of public health and is complying with the directive. Many of you know that there are health directors and health departments across the country have not been supported in that way, and I'm grateful for that. This is our best opportunity to slow the growth of the virus in our community and to help all of us to get back to those activities that are important to us. So again, I applaud those who are complying and ask for everyone to think seriously about the role that they play in helping get this pandemic under control in Mecklenburg County. So I want to also acknowledge the changes that have just been rolled out today in vaccine prioritization in North Carolina. We're working to address the new guidance, and I'll ask Meg Sullivan, our medical director, now to give us an update on the vaccine situation in Mecklenburg County.
Thank you, Gibby, and good afternoon, everyone. So I'm going to provide just a brief update around vaccines. So first, for some quick numbers, as of yesterday evening, Mecklenburg County Public Health has administered over 5,200 doses of the Pfizer vaccine, with another 500 doses or so to plan to be administered today. We are currently distributing the supply that we received this week, and at this time, we have not been provided with the number of doses we will receive next week. As Gibby referenced, we had a call with the North Carolina Department of Health and Human Services this morning where we learned about updated state guidance related to the prioritization for vaccine distribution. And I wanted to spend just a few minutes reviewing this updated framework. So the prioritization framework for vaccine distribution has been simplified as follows. There'll be 5 groups at this time. Group 1 is healthcare workers with in-person patient contact and long-term care staff and residents. This group is similar to the phase 1A that we have been vaccinating and referencing, but now has been expanded to include all healthcare workers who currently have in-person patient contact. We will continue to offer appointments for eligible individuals in this group who have not yet been vaccinated, as well as collaborate with both of our hospital systems to ensure access for these healthcare workers and our long-term care facility staff and residents. Group 2 is now older adults, which again is similar to phase 1B and currently phase 1B group 1. And currently appointments for group 2 in Mecklenburg County Public Health have been made for individuals ages 75 and older. Based on the updated guidance from North Carolina Department of Health and Human Services today, we will be expanding COVID-19 vaccine eligibility to all residents ages 65 years and older. However, we want to stress that our vaccine supply is still limited, and currently all of our available appointments are booked through the end of January. We are working with the North Carolina Department of Health and Human Services to secure additional vaccines, and will make additional appointments available as soon as possible. We will communicate through multiple channels when appointments are available for ages 65 to 74. We really appreciate everybody's patience as we quickly adjust to new guidance. To continue with the new prioritization framework, group 3 then will include frontline essential workers. At this time, we do not have a timeline for when appointments will be available for this group. As we have said previously, our ability to deliver vaccine in the community is limited by the current available vaccine supply. We are hopeful that as more vaccine becomes available in the county, we will be able to move through groups quickly so that we can begin to offer the vaccine to more individuals. Then just to finalize the framework, group 4 includes adults at high risk for exposure and increased risk of severe illness, which includes anyone ages 16 to 64 years old with high risk medical conditions, anyone who is incarcerated or otherwise living in close group living settings not already vaccinated, and essential workers not already vaccinated. And then group 5 will be everyone who wants a safe and effective COVID vaccine that doesn't fall into any of the other groups. Again, while our goal is to get people vaccinated as quickly as possible, we also continue to have limited supply and therefore anticipate it will still be months before vaccine is widely available to all groups. As I stated earlier, we still do not know our vaccine supply for next week, but we plan to continue to provide vaccine as quickly as we receive it at our Bojangles location, to our unenrolled long-term care facilities and other community partners, and at our second dose clinics through our Medic Fire partnership and our partnership with StarMed, while also making plans for rapid expansion and large-scale vaccination if and when supply allows. We remain committed to delivering vaccine as quickly and equitably as possible in our community, but I also want to take the opportunity to remind everyone, as Gibby mentioned, we continue to have too high numbers of cases, of hospitalizations and deaths in the county due to COVID, and that we all have a responsibility to follow all public health guidance to prevent further spread. Thank you.
Okay, first question today goes to Brett Jensen, WBT Radio.
Hi, thanks guys for doing this again. I think third time this week. I know we all appreciate it. It's probably your least favorite thing to do. But Real quick, Dr. Sullivan, I got two questions just because you said so. I just want to make sure I clarify and I understand and make sure we all understand. In terms of the vaccine, so what you're saying is that someone who's 65 won't be able to jump ahead of someone who's 78. You're going to wait till that, or someone who works in healthcare who's 25 and healthy won't be able to jump ahead of someone who's 75. Is that correct, or am I wrong?
So to clarify, we are still offering appointments for what we referred to before as Phase 1A and Phase 1B Group 1, which is now in the more simplified framework, Group 1 and Group 2. So Group 1 is healthcare workers who currently have in-person patient contact in the long-term care facility staff and residents. And then in Group 2 is older adults. At this time, we're doing appointments for 75 and older, and we're having conversations based on our vaccine supply and availability. We'll then make an announcement when we can make appointments for 65 and older.
All right, great, thanks. And so Gibby, in reference to the school board today, one of the school board members, Sean Strain, had some very pointed things to say about you, particularly today, and said that you thought one thing on Monday, changed your mind, and came back with a different recommendation on Tuesday, and even said at one point, which upset a lot of the school board members, that the school board was kissing your ring. I don't know if you heard about that, but did you change your mind from Monday to Tuesday? And what are your thoughts that he said that the school board is kissing your ring?
Well, I'm not exactly sure what that means, so it's hard to respond to that. But what I will say is on Monday, over the weekend, we'd had conversation with the school system. Dr. Sullivan and I were engaged with the administrative staff, talking about their plans to open. And at that point, our recommendation to them was that there was no public health justification for opening the schools at this point in time. We continue to support the need for our children to be in school, and we are willing to support whatever decision the Board of Education makes so we can make sure that the children are as safe as possible if the decision is made to bring back in. But we also let them know that if they were going to move forward, we didn't recommend them bringing more than the K through 5 in at this time. So that was the recommendation at that point in time, that we really did not have good justification for bringing the children back in, considering what was going on in the county. So from that perspective, I don't believe our recommendations to the school system changed. It's just that we were a bit more pointed on Tuesday when the directive came out, that we really believed that schools needed to be remote at this point in time. And I'm really not sure what his comment was about, so I don't feel like I can respond to it.
Yeah, I think he was just saying that that whatever you say, that they're immediately going to follow, and that you were more or less the leader.
Well, I appreciate the fact that they did listen to the directive and considered what we were asking them to do and why we were asking them to do it. That's all I can say about that.
Next question, Joe Bruno, WSOC TV.
You know, you have been strongly recommending people to do things for a while now, and our numbers just keep getting worse. So why not just go to the policy group and ask for some of these things that you would like to see, like non-essential businesses closing or 30% occupancy at indoor dining?
I can answer that, but I think Dina may want to talk about that as well.
Yeah, we have been having ongoing conversations with the policy group about additional restrictions. And to be perfectly frank, there was just not really an appetite amongst the group to put additional restrictions in place. You know, we had made we had talked about over the last several months about really aligning with what the governor does. And there was not really any interest in us moving away from any of the governor's executive orders or being more restrictive than what the governor has put in place, which is why Gibby decided to do the directive. It was really consistent with what Director or Secretary Cohn had put in place. And so we felt that would be the logical next step for this community.
Next question, Hannah Smoot, Charlotte Observer.
Hi, this is Hannah. Dr. Sullivan, you mentioned that you believe it'll be months before anyone in the general public can get a vaccine. Do you have, a rough estimate of when that is? We've heard sometime in the spring. Anything closer that you can give?
I still think it's really challenging, and obviously we've been asked that question a lot, and I wish we had a more specific answer. I think there's still a lot of uncertainty, both around the supply of the current 2 vaccines that have emergency use authorization, as well as if and when additional vaccines will be authorized and what that supply will be. So I think what I can say with confidence is that we are working to get vaccine out as quickly as possible, and we are optimistic that more and more vaccine will continue to come into the community, but I do not have a time frame right now. I think what we do know is that it still will be a significant amount of time, that while we are really proud of the vaccine efforts that we put forward, we still only have a very small number of people who are vaccinated, and really the public health prevention efforts are what's more important right now.
Next question, Paige Peroso, WPTV.
Hey there, thanks for taking our questions today. I know you mentioned that you don't have the exact number for next week's supply, but in the conversations with the state government, have they indicated that the county will be getting more supply, or is that what you're expecting since they've expanded this group?
I think we really don't have specifics. They indicated they do not expect a significant increase in the amount of supply that they are receiving as a state. And I think that was part of the conversation. Is we do know that the eligibility is being expanded, but we don't have guarantee that a significant increase in supply. And so I think that just goes back to what we said before, really appreciating everybody's patience as we move through these groups. And so right now, again, group 1, our healthcare workers who are patient-facing, long-term care facility residents and staff. Group 2, we right now still only have enough vaccine and appointment availability for individuals ages 75 and older. Our goal is to get it expanded to 65 and older as quickly as possible, but it really depends on what that vaccine supply is, and we just don't have that information right now.
Next question, Hunter Sines, WCNC.
Hey there, Gibby. Thank you all for talking with us. Gibby, this one's for you. Weighing the options, there's a lot of frustration from parents who want specifically some clarity. How is it truly worth keeping kids home for virtual learning at the expense of their education when you say school isn't a large source of COVID cases?
That's a great question. And I'll have to tell you, when I said that there are opinions on both sides, I'm getting probably equal numbers of emails from people who are thanking me for allowing their children to stay at home. So there are thoughts on both sides of that. We know at this point that based on the information that we have available to us, that children in schools are not a huge source of transmission. But we also know that the cases that come into the school are coming from outside in our community. Our teachers are being exposed. Our children are being exposed. And they do come in. And as we bring more and more children back in, the possibility of spread goes up. We have way too much virus in our community right now. And the whole intent behind the directive is for everyone to spend less time being exposed to others in the community. And that includes our teachers and our children. So the intent behind the directive is a broad community-wide effort to limit that exposure and to get our numbers down so that we can then open up more safely and make sure that once we get our children back in school that we're not having to close down again because we've got additional cases. So that would be the main purpose behind doing it at this point.
Next question, Chloe Leshner, WCNC.
Hi, thank you guys so much for doing this today. I know we've kind of talked about it and it depends on the vaccine supply, but is the county prepared staffing-wise to handle this influx of another group of people to get vaccinated? And we're still hearing people saying that they're having issues with the phone lines. So when you're adding more people, will you be able to handle adding more appointments too?
I think these are both really good questions, and this is something that we've been working on for weeks and months, is preparing for this. Staffing is obviously a challenge for everybody. We have both a surge of cases going on as well as a massive effort around vaccine distribution. We are exploring all options. We have hired additional staff. We are recruiting volunteers. We are utilizing existing staff and really working to do it. We're partnering with our EMTs and paramedics. And so we are prepared, as I talked about right now, kind of our current operations at Bojangles to be able to give out the supply as we get it, as well as making significant plans to be able to rapidly expand. And so we continue to explore those options. The same with our phone lines. Since we started this process, we have expanded our call center. We have additional hotline staff that are working on it every day. We do understand the frustrations, and I think I've mentioned this before. Our hotline staff are working extra hours. They're working weekends. They're trying to answer every call possible, return every voicemail, return every email. But we continue to work really hard so we can make sure we're as responsive to the community as possible.
Next question, Allison Kuznets, Charlotte Observer.
Hi, Gibby. It's Allison from the Charlotte Observer. Could you talk about the role of the county's COVID ambassadors right now and how their roles may have changed under your new directive? Are they looking for anything different during their visits and inspections? And a quick question for Dina. Are the park gates still open right now?
Well, I'll just start and say, yes, the park gates are still open. So you can use the parks. You just, they'll be available from dawn to dusk, but they are still open and the parking lots are still available.
Our COVID ambassadors are continuing to do the work that they've been doing since the beginning. The directive really does not create new restrictions or new guidance from us. It just reinforces the guidance that we've been asking of people for quite some time, is limiting your involvement with others outside of your immediate family to essential, necessary activity. And we just wanted to reinforce that. That's the reason behind the directive. The hope was to get people's attention and to say, this is really what you need to do. We've been asking you to do this. Now is the time to really double down and make sure that you're paying very much attention to that. So the work of the ambassadors is continuing, and they're working closely with our law enforcement entities if there's a need for enforcement, and we'll continue that work as we move forward.
Next question, Katie Peralta, Charlotte Agenda.
Hey, everyone. Thanks so much for taking my question today. I wanted to kind of circle back to something that Joe had asked about regarding about the county enacting its own restrictions. I understand that there might not have been an appetite for that among the policy group and among the towns, but this is a really, as you know, really difficult proposition for a small business that's struggling. So for instance, let's say a restaurant that does indoor dining. This is a business that's barely hanging on financially. What would you say to them if they are not required to close, but they're being asked to? How do you make the case for that if you're a business owner?
Well, I think, it's all about balance, right? And so I think that the directive is really designed to encourage people to just make sure that they are complying with the governor's executive order, particularly if you're a small business like a restaurant. It's a balance, and we understand the economy. And I think that was where the city and the towns were very concerned about putting additional restrictions in place because they wanted to try to support the local economy, which is what we all want to do. But when you see the numbers continuing to go up from a public health perspective, we have to be focused on what's in the best interest of the community from a public health perspective. That's the hat that we wear. And so while I understand the local economy and the impact on that, we have to be concerned about the number of cases in this community, and we can't just sit back while the cases continue to rise. We have to do what we can to try to get people to just make sure they're doing what we need them to do to protect themselves and to protect other people in the community.
Next question, Eric Spanberg, Charlotte Business Journal.
Picking up on that question that Katie just asked, Gibby, I'm wondering whether you feel the need or the inclination to make the case that without taking some drastic but voluntary steps that the economy will continue to sputter. In other words, that if you don't get those numbers down and get people healthy, you're not going to get anywhere either. And then secondly, I'm wondering for Dina, do you expect the county closings and telecommuting changes you made, do you expect those to only last 3 weeks, the same way that Gibby has said she only expects the directive to go 3 weeks?
Well, go ahead, Gibby.
Yeah, I would say that my concern is if we continue to operate as we are right now, our numbers will stay high and we'll continue to see issues in our community. I mean, we get to the point where you don't even have enough staff to run that small business because they're infected or they're having to be quarantined. So we want to try to calm things down, to cool off where we are right now, and try to get our numbers trending in the right direction so that we may even be able to open up more than we were before. And that's the intent. We want our children back in school. We want our businesses to be able to see people like they have in the past, but we've got to get to a place where it's safe to do that, because we need our hospitals to be able to handle the people that need to come in and receive their care. And we need other services to be able to get back to normal. So if we're not moving in that right direction, we'll just continue to stay high, and it will continue to cause problems for all of us across the board. So the intent is to try to take 3 weeks, cool things off, calm them down, and hope that the numbers are going to start going in the right direction so we can get back to some sense of normalcy as we get more vaccine and get that out to people. And if people are really doing the preventive measures that we know work, then I think we can get there.
And to the second part of your question, we'll continue to evaluate the situation as we move forward. And if there's a need to extend the directive for any reason, Mecklenburg County will follow suit as an organization.
And Dina, last thing, can you give me an idea what percentage of your employees are telecommuting at this point?
Oh boy, I would say the vast majority. I would say probably 75% or so are working remotely.
Right. Thank you.
Next question, Brandon Hamilton, WBTV.
Good afternoon. Gibby, this question is for you. With the directive and with the decision made by the school board as well today, school we know at least will be out till virtually till next month. A lot of parents, are kind of searching for what they can do. I know you also again reiterated to only go out for kind of those essential things. What would you tell parents or even students who may be listening, just kind of the different options or different things they could possibly do to kind of get rid of that steam that they are not getting by being back in person?
I know it's virtual learning works well for some and not well for others, and I recognize that. So I think there are ways for people to be active and to work off some of that steam, as you mentioned. We're not telling people not to go outside of their houses. The great outdoors are out there, walking, jogging, playing games in the backyard, those sorts of things. We want to encourage people to be active. We know that's important. And I guess the other thing to think about is that we're talking about another short period of time. Many of these kids have been in remote learning since the fall and actually since last spring. We know that this is another month that we're asking them to stay in remote learning. But again, we're hopefully moving out of that if we're able to get our numbers down. So we're asking people to be patient, to be creative. I think I mentioned, start cooking at home, doing different things with your children to help them learn in different ways is going to be critical for the next little bit.
Next question is Ryan Kruger, Fox 46.
Yeah, I wanted to know, are you hearing from any local businesses or any local restaurants that have agreed to follow this guidance and either shut down or have their employees work remotely? And if not, are you worried that, maybe after these 3 weeks, the numbers won't be going in the right direction because everybody will kind of be living as they have been for the last few months?
I mean, I've been getting some feedback by emails from people that things are shutting down. I don't know that for a fact. And we didn't necessarily mean for everybody to shut down completely, but to really limit the number of people that are in their facilities at any given time. And we're also asking individuals, as they think about going out to eat or going to a bar or going to any other business, to pay attention to what's going on around them. If there are people in there without masks on, if it's crowded, they should not go in. They should either come back another time or find another place to go. So my expectation was not that everybody was going to completely close down for 3 weeks, but really just pay a close attention and limit your exposure to other people as much as you can, because we know every time you go out of your house, the potential of exposure goes way up just because of the amount of virus we have in our community.
Next question is Tony Macias, Charlotte Ledger.
Thank you, and thanks for taking my question. My question is, I'm just wondering, why are hospitalizations so high? Winter, indoors more, but it's been 3 weeks since Christmas. Do you have any sense from contact tracing or anything about why these numbers are staying persistently high, and where the majority of these cases and hospitalizations are coming from?
We do know that hospitalizations occur after the numbers increase. So we're not surprised to see high numbers in our hospitals right now based on the increase in numbers that we've seen over the holidays. And when I say over the holidays, I mean even since Thanksgiving. So it's not unusual to see those numbers staying up this high, this far out from the holiday. Unfortunately, our numbers are not coming down, so we don't anticipate our hospital numbers coming down quickly. I don't think we have specific data at this point that could point to in specific individuals or groups of folks that are being hospitalized more than others, although we know that our elderly and those folks with chronic conditions are typically hospitalized more often than others.
Next question is Jacob Reynolds.
Oh, thanks for taking questions. A lot of news today, excitement about the Bank of America Stadium, the Speedway, the Spectrum Center potentially used as these vaccine sites. Can you talk a little bit about the excitement and the use of using big venues like that, and also any idea when you could start using those venues?
It's my understanding that the Speedway will have a 3-day event next weekend. I'm sure there'll be more information coming out about that, and that the event at the Panther Stadium will happen at the end of the month, a 3-day event. I'm not sure exactly when the Spectrum may be utilized. And a lot, again, depends, as Dr. Sullivan mentioned, on the availability of vaccine. We don't want to have huge events when we've only got 400 doses of vaccine, obviously. So we need to make sure that the vaccine is readily available. And we will continue to look in our community at ways to get the vaccine out into the community, not just in these big venues, but into some of those communities where we know we have our most vulnerable populations. So that will continue to evolve as we move into the spring, and we'll do our best to keep everybody aware of opportunities to access vaccine.
Hey, it's Joe. Just to follow up on a point that was made earlier, did you ask the city and the towns for permission for more restrictions and they denied you?
No, that's not how we work. We try to work by consensus. So it's not a situation where we just kind of walk in and say, here's what we want to do. Are you up or down? We try to work through it by consensus. So I wouldn't frame it that way. We just, kept waiting to see whether or not the governor would do more, and sort of wanted to see what the numbers were looking like. So we never really got to a place where it was sort of an up or down vote, and that's not really how we operate.
Hey there, Gina. Hey there, Gina. It's Hunter. I have a quick follow-up to that. We know that this directive doesn't have any teeth, and we've seen people even break the rules even when there are consequences to the rules. So how is this supposed to actually work, and why not put actual restrictions in place when we're technically at the worst percent positivity rate than we've been ever in this pandemic?
Because we really, the consensus where we got to is that the city, the towns, and the county, to some respect, was going to follow the governor's executive orders. We wanted to be in lockstep with the governor's executive orders, and that's where we've consistently stayed since probably the spring or the summer, maybe when ours sort of expired. And that's the road we've been on, and that's consistently where we have been.
Gibby, it's Allison from The Observer. We're adding about 900 cases every day. What would you expect that new daily caseload could be in 3 weeks' time? And obviously, we want to see that number go down. What would be a successful decrease for you to know that we can move out of this directive?
That's a great question. We really haven't come up with a specific number that we are looking for. I'm looking for any kind of decrease at this point because all we've seen is an increase since September. it's been a constant, steady upward trend on all of our metrics. So any kind of decrease would be a good thing to see. We will reassess this over the next couple of weeks and continue to watch those numbers. And at some point, we'll have conversations about whether there's anything more that we would like to do or feel like we need to do to keep that trending in that direction. But as we move into the spring, people can get outdoors more. We get more vaccine into individuals, and hopefully people continue to do the preventive things that we know work. Our numbers will continue to trend down. So we'll have to keep you posted on that, because it's amazing how quickly things can change with this pandemic. And at this point, I'm just looking for some sort of downward trend.
This is Brett Jensen. I know, Gibby, I know this is Brett Jensen. I know we talked a little bit about this yesterday. And this has nothing to do with you. Obviously, it's due to the many, many, many issues the state is having with this vaccine. Are you able to communicate with Novant and Atrium and get how many people they've actually vaccinated, so you have a percentage of the 75 and older? And is there any way possible to do with that the same thing with Walgreens and CVS? Because I know they're the ones doing most of it with the retirement centers and the nursing homes. Is there any way to get a grasp of what percentage of the people have been vaccinated in that age group?
So we have been having conversation. We meet weekly with the hospital systems to talk to them about vaccine distribution. We're doing our best to coordinate how we do that to make sure we're being, like I said, as equitable as possible to get that out. The challenge we've had with the numbers so far is we're all using the same state system, but we all don't have the ability to get that information back out of that state system at this point. So we're hoping the state will address that fairly soon, and that we'll be able to have those numbers more. But we're also talking to the hospitals about how we might be able to better share data to get some feel for that. To be perfectly honest, the state hasn't provided us, and actually with the pharmacies, that is a federal program, and the state doesn't have much more control over that than we do. So we don't even know exactly which pharmacies in Mecklenburg County are involved in that process right now. We've been attempting to have some conversation with them to see where they are in the process, but we've not had a lot of success yet.
Hey, it's Paige from WBTV. Gibby, you mentioned probably last week or a few weeks ago that you estimated that the population of 75 plus was roughly 20,000 people. I'm asking now, what's the estimation of that population now that's 65 plus? And then can you guys remind me of what the vaccine supply has been these past several weeks, or what the average has been? Thanks.
So, yeah, the estimates of that population, we haven't looked at that yet. What I can tell you is it's a lot more. So we'll take a look at that. And maybe the next time we talk, we'll have a number for you. And that 20,000 was probably an estimate of those folks who were outside of long-term care facilities and nursing homes. So, there are many more that we're not having to necessarily vaccinate all of those through the systems other than the pharmacies. So we will work on getting a better number for you on that. And the second question was about our vaccine doses, I think.
Yeah, just what has the supply been? I'm sorry, I just don't have the number off the top of my head.
Yeah, the first week we received, we don't receive Moderna. Everything we've gotten is Pfizer, and it comes in a tray of 975 doses. So the first week we got one tray of 975 doses. Every week since then, we've gotten two trays, which is 1,950 doses. And as Dr. Sullivan mentioned, we stretch that as far as we possibly can, but that's not a lot of vaccine based on the number of people that we have here in Mecklenburg County. So we're hoping, and we have been lobbying and having conversations. We just Dina and I had a conversation with Mandy Cohen this afternoon, and the first thing Dina asked for was more vaccine, more vaccine, more vaccine. So we're continuing to lobby them for more, and we're hoping that we're going to see that in coming weeks.
Last question, please.
Hey, this is Katie Peralta again from the agenda. I had another question that I wanted to follow up on. I think I asked this a few weeks ago, but I'm inquiring about the vaccination plan with frontline workers, including grocery store clerks and other individuals who are consumer facing. I know that y'all are waiting on guidance from the state on what sort of distribution plan that would look like. In other words, whether there would be any transportation available, what sort of burden the employer would bear, as well as how do you identify who these people are? Is there any further guidance on how that process is going to work, since that group does comprise a lot of hourly workers?
No, I think it's a great question. And I think it's one that's been a focus of ours, even as we obviously right now are really, providing vaccines for group 1 and group 2. But we know that that is such an important group, and one that we're going to have to be incredibly, I think, innovative about how we deliver vaccine and use many different ways. So, I think part of the guidance that in conversations we're having with the state is first to clearly define who is included in that group, and then to identify within who is included how we can deliver vaccines. So, using kind of our typical, vaccination clinics and working with our community partners who will have vaccine at that time. But as you mentioned, transportation options, which is something that we're already working on, working directly with employers, going out into the community and being more mobile. These are all things that we're having conversations with internally with our hospital systems and with the state. And we anticipate, hopefully, as we can move into that group as quickly as possible and then work to get vaccine out as quickly as possible.
Thank you, everyone.